Okay, good morning. Good morning, everyone. Today I'm taking you guys along in the day of a life of a general dentist. And just coming in a little bit early in the morning. It's about 7:30 right now, and I'm supposed to be at work at about 8. I don't have much of a commute, so I'm going to get there in no time. And I just want to give a little information. So I work at a federally qualified health center, and this is a health center that, at least ours, has medical, dental, behavioral health, and pharmacy. And we mainly see a lot of underserved, uninsured, underinsured populations. Of course, we see everybody else, but that's kind of what these centers are for. And so patients that come in usually don't have much and can also apply for what we have a sliding fee scale. And so they can come in and apply, and based on their income, they have, they pay a certain fee no matter how much dentistry we do for them. So that's kind of, my interest, working with the underserved, and that's why I'm working at an FQHC. I say this to say a day in the life of a general dentist is different for every dentist, because we have people that work in private practice, we have people that work in corporate dentistry, we have business owners, associates, and all that sort of thing. And everybody's day is slightly different. The dentistry itself is pretty much the same, but probably the schedules will be different. The type of patients you see will be different, and all of that. So, what else? Yeah, but so come along with me as I go. I'm going to record as much as I can. We'll see what I can get, and we'll see what I can't get. All right. All right, I'm here a whole 15 minutes early, and first one and only one in today. So it's typically 3 of us here, but today I'm the only one here. And so I'm going to go ahead, probably make some tea, and then get on my jacket, review cases, go over some lab cases. I have deliveries today, some dentures, and I believe I have a crown or bridge delivery. So I'm going to go ahead, look through those cases, and then, yeah, that's pretty much what it is for the beginning of my day. Yep, so I usually check on whatever cases we have. If we have a final impression, just check on the trays, the custom trays that have been made. The assistants generally make all these things. So, the morning of, check it and make sure everything looks good before the patients show up. All right, so I am just in my room now, or one of the clinic rooms, and I wanted to show it to you guys before it gets busy, because once patients are here, I probably won't even get the chance to do this. But these FQHCs, they have this, people think that they're not, I guess, the best clinics because they're mainly for underserved, but most of the time they're actually in excellent condition. They actually look like private practices. They feel like it, and that's something that I'm very proud of, because we're able to give care to those that can't really afford to go anywhere else. And when they come in here, they are almost surprised that it's this great. So this is ours, or one of ours. Really nice room. Here, I'll flip the camera around. So this is it. Just like any other practice. Very nice, very clean, and we actually have a TV that we turn on when patients lay down, so we can watch whatever it is that we have on there. It's typically cartoons, but it's really nice. Our clinic has a couple rooms, I think 9 or 10 rooms. This is one of the rooms. Beautiful view as well. Yeah, so it's standardized in that sense. But yeah, all these rooms, I'm only using 2 of them today. So this one and this one. Our clinic has about 9 or 10 rooms. There are 3 dentists here and 2 hygienists, so we're kind of busy. We're seeing a lot of patients. And actually for my clinic, we see we have a jail right down the street, and so the inmates get to come in and also get their teeth taken care of, because they're human too, right? And so that's kind of nice. We get to serve a whole range of patients, and I really enjoy doing that, getting to know them, getting to understand, I guess, rural living. I never really grew up in a rural place. I grew up in an underserved country, but a rural place is slightly different. And so hearing these patients and their stories and how, life is for them, it's different from mine, but we get to learn about it. So that's kind of it today. We'll see what else I can record. Again, like I said, it's just me here today and one assistant, so it's not going to be as busy as our typical day that gets, which is why I chose today to make this video. All right, I'll get back to you guys in a bit. Let's get this tea nice and hot. It's too hot. Okay, we'll try this again. Tea's too hot. Was too hot. Still have the label down here. Much better. Yeah. Get this off. Okay, so it's almost 8 o'clock. The front desk, usually for me when I come in the morning and for all the doctors here, they print out our schedules, so we know, what the day is about and if there have been any cancellations or reschedules. And we go through the schedules, look through our patients' medical histories and see where we are in treatment. And then if there are cancellations or reschedules, we try to fill those in by calling other patients. So for FQHCs, a lot of the struggle with patients is that a lot of them depend on public transportation to come in, and not just public transportation like buses, trains, but there's a system here at least called Dial a Ride, and so they have to call ahead of time and schedule for pickup. A lot of people here don't have cars, they don't have any mode of transportation. And so if for some reason that Dial a Ride transportation is running late to pick them up, then, they're going to be late. At our clinic, we give about a 15-minute grace period, but again, it's case by case. So if a patient is, a little over 15 minutes late, depending on what we're doing, we'll still see them. And sometimes, if it's a long procedure and we have patients after that, then we're not able to see them. And so, but we're very... understanding of the patient population here. It's different, but it's definitely worth it. Okay, so I'm going to go ahead and get my day started. I have a filling first, and then after that I have an extraction, and so it's going to get busy, and then I'll come back during lunch just to update you guys on what I have done during the day. Okay, it's lunchtime now, and I just ate my lunch, and morning was good. I had a bridge delivery, 2 fillings, 1 new patient exam, and a denture delivery. So not that many patients, but we had a cancellation as well. So for our FQHC, we typically see 2 emergency patients in the morning and in the afternoon. But since it's just me today, we just saw 1. So gonna just relax for the next few minutes. I have about 10 minutes until my lunch break is over, and then I move on to the afternoon session. Okay, bye-bye. Okay, I'm back, done with the rest of the day. Yay! We saw, how many more patients? I think 6 more patients, so total today of about 12. Most of the time that's our average. We schedule between 10 to 15 patients a day, and with the cancellations, walk-ins, we get, 12 to 15 that come in per doc, sometimes more, sometimes less, based on the weather, based on a whole bunch of other things. So yeah, that's pretty much what my day looks like. Today was a little bit of a shorter day. On Fridays we close at 4:30, and I typically don't even work on Fridays, but today I'm here, and so it was 8 to 4:30 were the hours with a lunch break. So I'm trying to think of what else, but that's pretty much what my average day looks like. I hope you all enjoyed, and if you have any questions, please feel free to put them down in the comment section, and if I can answer them, I will in the next couple of videos. All right, take care. Bye-bye.